In this particular video, we are going to discuss regarding asthma. Asthma is an important question for university examination, as well it is also important for many other competitive examinations. So going to details, before going to definition of asthma, first we need to know what causes asthma. So asthma is caused by allergens. Allergens can be dust particles or pollen grains, anything it can be, or pollen, anything it can be. So whenever the person inhales the allergens, they enter the trachea through respiratory tract, they enter the trachea, then bronchi. So in short, the allergen enters the tracheobronchial tree. The allergen enters the tracheobronchial tree. Whenever the allergen enters the tracheobronchial tree, what happens is, already the person is having hypersensitivity. The person is hypersensitive. Already the person is hypersensitive. So whenever the dust particle of the allergen enters the tracheobronchial tree, what happens is that the trachea and bronchi, they undergo spasmodic narrowing. The trachea and bronchi, they undergo spasmodic narrowing. Why undergo spasmodic narrowing? Because as allergen enters the tracheobronchial tree, and already the person is having hypersensitive. So because of this, the trachea and bronchi undergo spasmodic narrowing. So as the trachea and bronchi undergo spasmodic narrowing, what happens normally? So trachea and bronchi undergo narrowing. Trachea and bronchi becoming narrow. So due to which air does not go to lung properly. Air does not go properly to alveoli and lung, and it leads to attack of asthma. So this is what was happening in asthma. It is the overview of what was happening in asthma. So going to detail the definition of asthma. Coming to definition of asthma. Asthma is disease of airways. Asthma is the definition of is disease of airways that is caused by increased responsiveness of tracheobronchial tree to a variety of stimuli and widespread of spasmodic narrowing of airways because of the allergen. So relieved spontaneously by therapy. So during attack of asthma, person will have respiratory distress. So in person with hypersensitivity, whenever allergen goes inside, it causes spasmodic narrowing of tracheobronchial tree, due to which air does not go properly. It will lead to attack of asthma. So this is the definition of asthma in detail and overview of asthma. So the location is trachea and bronchi, and etiology is allergen. Allergen is causing this entire process. It is causing spasmodic narrowing of tracheobronchial tree, which leads to air does not go properly to the lungs. Air doesn't reaches properly to the alveoli. So it is gonna cause acute asthmatic attack. So the pathogenesis it follows type 1 hypersensitivity reaction. So rather than definition, this pathogenesis of asthma is very much important. The pathogenesis of asthma is very much important for MCQ point of view as well. So in MCQ, they may ask which hypersensitivity reaction as asthma follows. It's going to follow the type 1 hypersensitivity reaction. We're going to discuss this in detail. So pathogenesis of asthma. So coming to the pathogenesis of asthma, which is very much important for examination point of view, we also note that the asthma follows type 1 hypersensitivity reaction, which is very much important. So first one is, whenever the allergen enters the body through nose, this is allergen. Whenever the allergen enters the respiratory tract through nose, it is gonna come in contact with the antigen presenting cell, APC, particularly the dendritic cell, and many are there, particularly dendritic cell. So the allergen, which is an antigen. So this allergen is nothing but it is antigen. Whenever the allergen enters, it's going to come in contact with antigen presenting cell, APC. So whenever the allergen come in contact with antigen presenting cell, the antigen presenting cell will engulf the antigen presenting cell will engulf the allergen. So in second step what happens is the antigen presenting cell will engulf the allergen. So once the antigen presenting cell engulfed the allergen, it's gonna degranulate, it's gonna degrade the allergen into multiple pieces. The antigen presenting cell in the next step, it's going to degrade the allergen or antigen into multiple pieces, and thereafter the antigen presenting cell, this APC, once it degrades the allergen into multiple pieces, it's gonna on its surface. Once it degrades the allergen into multiple pieces, then it's going to present them on its surface. In the next step, in the third step. So first step what happening is the allergen, which is antigen, it come in, once it enters the body, it come in contact with the antigen presenting cell, particularly the dendritic cell. In second step what happens is the allergen is engulfed by antigen presenting cell, and in the third step the allergen which is engulfed by antigen presenting cell is going to degrade into multiple pieces, and in the fourth step the degraded allergen molecules were presented on the surface by antigen presenting cell. So the antigen presenting cell presents the allergen on its surface. The APC presented the allergens, degraded allergens on its surface. So until then it's clear, isn't it? Then as the APC presented the allergen on its surface, APC, antigen presenting cell, presented the allergens on its surface. Now in the next step what happening is this antigen presenting cell is going to activate T cell, is going to present the allergen to the T cell or going to activate T cell. The T cell then differentiate into T helper 2 cell, Th2 cell. The Th2 cell in turn present or in turn activate the B cell, B lymphocyte B cell, by secreting interleukin 4. So the T helper 2 cell, what happening here is that, so the APC which is having allergen on its antigen on its surface, which allergen on its surface, is going to activate the T, is going to present them to T cell or activates the T cell, and which is going to differentiate into T helper 2 cell. The differentiated T helper 2 cell is going to secrete interleukin 3, 4, 5, of which interleukin 4 is important. The interleukin 4 is going to activate the B cell. The interleukin 4 is going to activate B cell. So the activated B cell is going to secrete, the activated B cell is going to in turn activate plasma cell, IgE secreting plasma cell. So the plasma cell in turn secretes IgE antibodies. Until then, is it clear? So the APC, which is having allergen on its surface, is going to activate or present the allergen to T cell or going to activate the T cell. The T cell in turn differentiate to T helper 2 cell. The differentiated T helper 2 cell is going to activate interleukin 3, interleukin 4, interleukin 5. Particularly the interleukin 4 is going to activate the B cell. The activated B cell in turn activates the IgE secreting plasma cell. The IgE secreting plasma cell is going to secrete IgE antibodies. So these IgE antibodies, they go to the MASH cell and they bind to the Fc receptors on the MASH cell. So the IgE receptors, the IgE antibodies, so these are IgE antibodies, binds to the MASH cell, and this binding of IgE antibodies to the MASH cell is known as sensitization. It is known as this sensitization. So this binding of IgE antibodies to the MASH cell is known as sensitization. Why it is called sensitization, we will explain in next slide. So once the MASH cell is already sensitized right now, so the MASH cell was sensitized with IgE antibodies, isn't it? It is during first attack. So it is during the initial attack of allergen. It is during the first attack of allergen. So the entire process happened and there is sensitization of MASH cell occurred. But during the second attack of the same allergen or the same dust particle during second attack, the entire process will not happen. So already the MASH cell was sensitized. The MASH cell was already sensitized during first attack. which is also having IgE antibodies. The mast cell was already sensitive during first attack, and it is also having the IgE antibodies. So during second attack of the same allergen, so during second entry of same allergen, so what happens is the IgE antibodies gets activated. The activated IgE antibodies are gonna secrete or gonna activate the basophils, which gonna cause the mast cell lysis. They cause mast cell lysis or degranulation of mast cell. They cause the degranulation of mast cell. So during second attack, what happened? They cause the degranulation of mast cell. So it's gonna cause degranulation of mast cell. It's gonna secrete leukotriene B4 and D4. The secretion of leukotriene B4 and D4 is gonna cause the bronchospasm and the tracheospasm. So the bronchospasm and tracheospasm is the main pathogenesis of asthma. It is going to result in asthma attack. It is going to result in asthma attack. I think the entire pathogenesis was quite difficult to remember. So we will explain clear neat diagram in small simple diagram. So what happening initially? The allergen enters through nose to the respiratory tract. So after the allergen enters through nose to the respiratory tract, it's going to come in contact with the antigen presenting cell. So 3 steps happen now. So the antigen presenting cell will engulf the allergen and is going to make the allergen into pieces. The allergen is nothing but it is antigen. Is going to make the allergen into multiple pieces and is going to present the allergen on its surface. So once the APC, the antigen presenting cell, presents the allergen on its surface. Now in the next step, what happened? This is going to activate or present the allergen. Antigen presenting cell will present the allergen to the T cell. The T cell is going to differentiate it into T helper cell, TH2 cell. The TH2 cell in turn, is going to secrete interleukin 3, 4, 5, of which interleukin 4 is very much important. This interleukin 4 is going to activate the B cell. This interleukin 4 is going to activate B cell. This B cell in turn activates IgE secreting plasma cell. So the B cell in turn activates IgE secreting plasma cell. This plasma cell is going to secrete the IgE antibodies. The IgE antibodies go and attach to Fc receptors of mast cell. This is mast cell. The IgE antibodies goes and attaches to Fc receptors of mast cell. So this is all happened during first attack by allergen. So during second attack of allergen, what happened? Directly the allergen or the antigen during second attack, it's gonna activate the IgE antibodies of mast cell. These IgE antibodies are gonna cause degranulation of mast cell. The IgE antibodies are gonna cause degranulation of mast cell. The degranulation of mast cell. The degranulation of mast cell is gonna secrete leukotriene B4 and D4. The secreted leukotriene B4 and D4 is gonna cause the bronchospasm and tracheospasm. The bronchospasm and tracheospasm is the main pathogenesis of it's result in asthma. The bronchospasm and tracheospasm is going to result in asthma. So if you still does not understand the pathogenesis properly, in the next simple video I will keep a video regarding pathogenesis of asthma in just 2 to 3 minutes. It will be quite understandable than this. Thank you.